Assalamu alaikum, Bismillah Rahman Rahim. I think you're all tired and so many speeches have happened. I'll just be short and sweet and crisp. I think I was very impressed with what Professor Hassan Iqbal said, and I think that all of us need to have a thought about it. We can achieve nation building and how we can contribute to safety and progress of Pakistan. And it is crucial for us to contribute. So I think that, in my opinion, PPS needs to be very focused and focused on issues and projects which are implementable. And in my opinion, the most important, Said Farooq mentioned schizophrenia and that, but I think adolescent mental health is so crucial and important that you must focus on that. And I keep meeting legislatures, by that I mean senators and MNAs, and all of them mention that how the youth is marginalized, they have a lot of anger and bitterness in them, and they are very frustrated and they are very negative, which is exactly what Hassan Iqbal Saab said. So I think that PPS needs to focus on that. I think adolescent mental health is one area where PPS needs to focus. Then secondly, I think that we are very poor in grabbing research grants from international sources. And India is very fast in terms of us. So I think, again, PPS should have a research cell or some kind of a cell which actively, with the collaboration of Saeed Farooq has done so much for us, but it's just not enough. We need more. So we need to tap more grants. We need to focus more on getting more research into mental health and into and funding into Pakistan. So I think that those two areas are so crucial. Apart from that, in my opinion, the use of technology and AI and apps for cognitive behavior therapy and all these new things that keep coming up, again, very, very crucial that we use them because it's cheap, effective source of mental health service for the poor in the community. Now, I come back to PMDC, and again, it's a remarkable achievement that I am, being a psychiatrist, I'm president of PMDC, and within a span of less than 1 year, we have managed to increase the hours to 150, and we have made it mandatory for all medical schools to have mental psychiatry departments. And if we just mention that there are about 135 medical schools, so across Pakistan, you will have 135 mental psychiatry departments, and they will actually serve the population. But I'm really, 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 really disappointed that speaker after speaker keeps mentioning this figure of 900, 900, 900. I don't think we should publicize that too much. I think we need to work, and all of us are teachers, so we should fill that vacuum so that those departments that we will be conducting visits of across Pakistan this year will have will be fully equipped with the properly trained staff. So I think that these are the areas that PPS should be focused on. And apart from that, I think you need to understand that all this issue about mental health and its escalation and the distress in the population started with the pandemic, and then we went on to the economic slump after that, and which Pakistan is still going through. And now we are in the phase of climate change, pollution, and war is creeping up very slowly towards Pakistan. And we are we need to be very vigilant, and we need to have preventive strategies for our population. So PMDC has included the lifestyle medicine and preventive medicine in its curriculum as well. Then I think that you all need to look at other ways that we can support you. Professor Iqbal Afridi has been after me about the journal. He used to call, I think he must have called me 100 times. But we managed to get it in the end. We managed to get it PMDC recognized. So again, the service. Now we are working on the curriculum, and Professor Ghulam Rasool has already sent me a template of a curriculum, and we'll hope to achieve some kind of very robust curriculum for mental health to be taught to our future generation of medical students. So I think, in my opinion, we should be focused. Somebody said there are 3 generations, which I agree with. 3 generations of psychiatrists here, and I'm very encouraged when I look at the groups and the messages and the interventions and the conferences and the meetings and the educational activities that the young lot are doing. And I'm fully supportive of them, and this must continue. So I'm very hopeful and for the future of psychiatry as well. I think Professor Saeed Farooq was right about the universal health package, which doesn't really cover mental health. It does mention in a few sentences. And I've been in many meetings, and unfortunately, there is a lack of understanding about the importance of mental health in different professionals, including our own medical fraternity. Same was for when we were increasing the hours, they would not understand it, and they had actually rejected it. But actually I had to push my way through it. But fortunately we got, so we need to have some kind of a coverage system for the population, because by any standards, the population with mental health problems are not productive and unemployed as well. Now, I think you all need to give me some recommendation after the conference is over, and I promise you that we will, inshallah, work on it. Professor Ziaulak is with us in the academic board. Umar Saab has just left. Professor Shoaib Shafi is also in the academic board. So we will all work together, and we will hope to achieve, and I'm almost sure that we must achieve the best. One last point I want to mention. Last Sunday, we had a brunch with Palestinian medical students. And after talking to them for a few minutes, they all would start to cry. And I just kept on thinking how ungrateful we are for what we have. And that is exactly what Hassan Iqbal Sahab was also saying. We have everything. We have food, we have a roof over our head, we have institutions. They have nothing. They have nothing. And they kept on mentioning they have lost everything. They've lost their families. And we must understand and be grateful. And this is also part of our religion, कि अल्लाह से शुक्र अदा करना चाहिए और बेहतरी का सोचना चाहिए, न सिर्फ अपने लिए बल्कि तमाम आवाम के लिए और पाकिस्तान की तरक्की के लिए. Thank you very much.